I presented also today the first results of the GMMG-CONCEPT trial. This is a truly academic investigator-initiated trial I'm heading in Germany in 20 centers. We reported about the first 10 patients, all patients there. The trial includes only newly diagnosed high-risk cytogenetic patients receive a quadruplet consisted of an anti-CD38 antibody, the isatuximab, in combination with carfilzomib, lenalidomide, and dexamethasone. And we want to achieve in this high-risk patient population MRD-negative disease. This is the primary endpoint. Here we reported about the safety run-in phase, and we saw an overall very favorable safety profile. We had no discontinuations due to adverse events. We saw no early death. And we see that quadruplet treatment can be well tolerated. The trial is running as of now. There are 112 of 153 patients included, and the oldest patient is 87 years old in this trial. So that shows us that those quadruplet regimens, including the anti-CD38 antibody strategies, are really well tolerated, and we have very good experience also with the more potent proteasome inhibition using here carfilzomib instead of bortezomib. And we see especially a big relief regarding the lack of peripheral neuropathy in our patients.